Ladies and gentlemen, we are so pleased to bring you our grand finale for day one. It's been wonderful to have you here as part of the M42 journey at the inaugural Abu Dhabi Global Healthcare Week. Now, this particular session, wow, we're in for such a treat. We have an illustrious lineup. We have the stage set for us. Thank you for bearing with us. And we are looking at the Abu Dhabi Biobank, a new dawn in personalized health. This is such an exciting topic area. To moderate this, please do welcome on stage Paul Downey, the General Manager at the Abu Dhabi Biobank. Please do welcome Paul on stage. And if I can ask everybody to sit underneath their names. Dr. Samaya Zahir, who is a Medical Director at Danat Al Emirat. Dr. Samaya and I met at Arab Health, so it's wonderful to have you back with us. Dr. Brenda McLaughlin, the Chief Medical Officer at Kanad Hospital. Dr. Brenda. Dr. Samina Dornan, who's a Consultant Maternal Fetal Medicine at Al Zahra Hospital. And Dr. Hatim Sadamed, who's the Head of Cord Bank at the M42. Just to make sure that everybody's in their right position. Over to you, Paul. Thank you.
Thank you and good afternoon, everybody. This session is titled Biobanking, a new dawn in personalised medicine. Biobanking is a widely used term these days and it can mean different things to different people. The purpose of this session is to discuss cord stem cell banking, both public and private. And we give thanks to the DOH for having the foresight and the initiative to fund a public stem cell bank, which will be really the focus of this session, and the panelists will explain what is meant by a public stem cell bank. I think on that note, I will defer to my esteemed colleague, Dr. Brenda, Chief Medical Officer at Kanad Hospital in Al Ain, to talk about stem cell banking in a busy maternity hospital and what the advent of a public stem cell bank would mean for her hospital and her patients. Dr. Brenda.
So we're really excited that DOH has partnered with M42 in this adventure because it really gives an extra option for our patients. Currently, the only available option for a patient is to do private banking before M42 comes along. And so this entails a patient signing a contract with a private company, and then they usually have to pay a large amount of money in order to store the stem cells. And this gives the opportunity for everyone to contribute to a biobank where it's free for them, first of all. So the large amount of money that is paid in the private sector to store the stem cells isn't there. We are able to collect the cells for free for the patient, and then thanks to the partnership with DOH, they're able to fund the public bank. And so really everyone from all nationalities are able to donate to this and also to receive from the bank. And so that's a really exciting opportunity that we have here, because everyone living here knows that we have so many different nationalities that live and are with us. And so it's really a great opportunity to collect a large sample from a diverse population to be able to store it and to help a greater diversity of patients.
Thank you, Dr. Brenda. Leads nicely into my question for Dr. Hatim on the benefits of a public bank at scale, reflecting local genetics and the benefits to acceptance of the stem cell transplant in the longer term. There's perhaps a bit of a misconception about private stem cell banking, and that's a panacea for the family. So maybe you could talk to the science of public stem cell banking.
Yeah, thank you, Paul. Actually, to start with, we have to define the public banking and private banking. Public banking is the donation of your cord blood to the public banking bank so as anyone can use it. The private banking is you donate or you store your cord blood for your own family. That means you are paying fees, you are store it, you are the one who are control it, then you are using it for your siblings or your whatever patient you are going to treat. That means there is a reason behind the storing for private banking. The public banking is to help the whole nation, to help the whole world. That means, as we know, for the transplant, you need to have a fully match for the bone marrow transplant. So the public donation, it will encourage people to do this because it's expanding the variety of the HLA. So you will have a good bank, a good resources to cover everyone. That means you are giving a chance for everyone who need this transplant by mean of increasing the pool of donation, the pool of donors. And that will not guarantee that if you are donating your cord blood, that means you are going to have it. It's something like the blood bank. You are going to donate your blood. The country will assure that whenever you need the blood, you will find the blood. The blood with certain criteria, that is, it's matching you. For example, that blood group, but here it's matching you as HLA. So it's a matter of donation that will help the whole nation. And this is the idea behind public donation. And as we said, for the mothers always, we're encouraging actually public banking, because in public banking, the mother will not give one life, it will give two lives actually. She will give the life, the one she is going to deliver, and she will give the hope for somebody who's desperate to have a donor. So you are delivering two life in the same time. Thank you.
Thank you. Thank you, Dr. Hatim. A question for Dr. Samina. Dr. Hatim makes the point that you need a certain number of stem cells to have effective therapy. I believe it's 2 million, which requires a collection of around 102 millilitres of cord blood, which can be challenging. I'd welcome your thoughts on that as a clinical challenge to collect that much blood, and also some of the barriers to successful collection that you may see in your hospital.
Yeah. Hello, everyone. Good afternoon. It is a wonderful opportunity to speak about something which is actually not new. It is 20, 30 years since, and the first time the stem cell was given was in 1966. Can you believe it? And it was 20 years ago that we started stem cell bank in United Kingdom, and of course in America. I'm sure it was before that. So I do feel this is wonderful opportunity to educate the public, especially the medics, and then of course through the medics to educate the public. Dr. Hatim beautifully said about the public bank and about the individual bank. I think the way forward is that please give for individual bank, and you should have access to the national bank. Because remember, your baby most probably will need somebody else's blood, stem cells, rather than its own. So there are very few conditions in which the fetuses use their own blood. There are mostly you need somebody's A, but there needs to be HLA typing, as Dr. Hatim very nicely said. And it's very important. The national banks are important because national bank has a versatility of population. So it's very rare for an Asian person to find a match, HLA match, in a Caucasian bank. So it is important that nationally we collect and we divide these stem cells so people, when they need them, we can provide them. As far as the challenges of collection is coming, people find it expensive. There are too many companies, too many commercial interests, and I think regulation needs to, it's already there, which is very, very promising. Already there is a law that they have to have a lab here in the UAE before they can do that, which is hugely welcome and points towards what Dr. Hatim said, that if you don't collect enough cells and you don't separate stem cells quick enough from the blood, you lose them the longer they are. So we used to send them outside. That was one of the challenge, which has now overcome by making sure that companies which have a license have a local labs so they can separate them locally. The other thing is that people talk about, because this is very fashionable now, delayed cord clamping and collection of stem cells. Please remember, you know, I have been collecting stem cells now for over 20 years. The two things don't go together. Delayed cord clamping will reduce the amount of collection of blood. And if you are collecting it for private, you are paying a lot of money. The company is still going to say, voila, we got enough, but they will not get enough. So when you are going on this direction, please do not say that please do the delayed cord clamping. If you want to collect stem cells, You need to go, 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 go. There is no other way of collecting a properly huge amount. And I do feel that we need to maybe subsidize it a little bit, the stem cell collection for the parents, or maybe regulate it a bit more. So price-wise, it is better. I strongly believe the future of medicine is stem cells. It's not going to be antibiotics. It's not going to be organ transplants. It is going to be stem cells. Whether I will see it in my lifetime, I doubt, but at least we are making progress.
Thank you. Yes, Dr. Samaya.
Yes, I just wanted to jump in, if that was okay, to some of the points that Dr. Samina touched on. So particularly the barriers, because I think that's a huge important. We all know the concept or the idea. We keep hearing about precision medicine and precise care. We hear about biobanking, but I still think there's a massive push that's needed really to improve awareness and increase engagement. Now, you mentioned very nicely, Dr. Samina, about delayed cord clamping, and perhaps that's one of our challenges. So delayed cord clamping has very successfully had that message both to healthcare providers and to the wider public as to the benefits of delayed cord clamping, and very much so. And they've had massive support in their public education campaigns. And as a result, you know, we're behind substantially in biobanking. So I think there needs to be more awareness amongst healthcare providers and the public. So we've established that biobanking is a critical cornerstone for the delivery of precision medicine. But how do we get that transformation? And that transformation needs collaboration between all of the stakeholders that deliver healthcare systems. So that's going to be policymakers, the patients, physicians, healthcare providers. I think the primary obstacle to this is really lack of awareness. There's inadequate public education campaigns. There's limited participation from healthcare providers in research activities. And so in order to do that, we need to understand healthcare providers' knowledge and attitudes towards biobanking. And once we understand it, we can actually then tailor focused, vigorous, and more importantly, sustained information and knowledge and training. Not so much on the collection of specimens, but actually about the general rationale and the concept behind biobanking, the importance of it, what is the potential impact and value to patients. And only then can we ask healthcare providers and the patients to engage more and contribute effectively to that delivery of precise care. Sorry for jumping in.
No, not at all. Excellent points, well made.
Can I come in just one more point on that? Dr. Sumaya has just wonderfully said that patient selection. She's so right that when we are delivering severely premature babies, growth-restricted babies, they really do need delayed cord clamping. But their umbilical cords are so thin, their placentas are so small, that there is not a chance in hell that you can collect stem cells and do the delayed cord clamping. So selection of patient, awareness, very, very important. Every patient is not suitable for stem cell collection. So I agree.
Yeah, thank you. Listening to the conversation and my own thoughts as well, it feels like our job as members of the healthcare ecosystem, albeit from different organisations, is to impart this knowledge both into the physicians but critically into the public as well, that they understand the choices, they understand the benefits of public stem cell banking versus the benefits of private banking. As it stands today in the UAE, about 95% of stem cell units go to clinical waste, which is a complete shame. We're disposing of a therapeutical unit. So I believe that, and the only way is this consistent messaging, science-led education, fact-based about the benefits of stem cell collection for the individual and for the wider society. And particularly, I think, and I'll open this up to Dr. Hatim and the rest of the panel, the need to have a stem cell bank that represents the local population. So we had this discussion amongst ourselves about the London stem cell bank and what does a Londoner actually look like genetically? It's almost impossible to define. Dr. Hatim, the importance of a local stem cell bank?
Yeah, again, we'll come to the transplant issue, which is the main focus of any core blood banking. So, to the recent publication said that the ethnic group, the ancestry, all it will have a good reflect or a bad reflect in your transplant. So, whenever we know that the transplant is going according to the HLA. So you can find a Caucasian guy who is fully matched with a black guy in a matter of HLA in the alleles. But when you transplant it, according to some ethnic groups and some sub alleles, again you will find the rejection or graft versus host disease developed in some ethnic group. And this is, we call it like the minor groups. And as we are in the Middle East, we are not well represented in the national registry like WMDA, NMDB. That means we need to have our own core blood banking so as to have a pool of HLA which can reflect in this registry so as to get donor for our patient. In addition to that, even when we got these donors, we need to have a match donor in a matter of ethnic and in HLA match. Yeah.
Thank you.
So this will help a lot in a matter of time.
Thank you, Dr. Hatim. A question for Dr. Samia. So we've piloted the public stem cell collection in Danat and Al Amarat over the last 4 or 5 months and recruited a significant number of donations. Perhaps, Dr. Samia, some of the challenges, some of the questions that parents are asking around public stem cell banking and how you've approached those questions and overcome them to successfully bank the sample?
So, yeah, we've been delighted to get on board this partnership, and I look forward to kind of even more success. I think certainly some of the challenges have been, firstly, the lack of awareness on both parts. So we have to be honest and admit it's both on part of the physicians and the public, and that's ongoing. That's a work in progress. Education and knowledge will only increase and expand, and our confidence in giving across that information and assurances to the patients, and even the ability and confidence to approach them in the first place and ask their willingness to participate, and managing that entire consent process will grow with time. And so I think that's one of the challenges, but it will almost improve itself and deal itself. Some of the other challenges are perhaps kind of that misconception that there's extra work for the healthcare providers. Perhaps it interferes with the delivery process. It might delay or increase bleeding if it's an emergency delivery. The issue around the delayed cord clamping. So that public message of we all know the benefits of delayed cord clamping, and a lot of the maternity care providers will be under the misconception that actually, okay, well, the delayed cord clamping will help this child today. So why not? Why am I reducing this benefit I'm giving for the altruistic effect of improving somebody else? So it's dealing again with that knowledge, and I think it's just about understanding the attitudes and the knowledge of our staff so that we can perhaps target and focus our strategies.
Thank you very much. Dr.
Can I
Brenda?
say one thing on that also? Is one of the questions is people often think, well, I want to store the stem cells so my child or one of the siblings will be able to benefit later on. For that child, there's a very small chance that they will be able to use their own stem cells because a lot of the diseases that are treated are genetic in origin, so you can't usually get the transplant from yourself. So that the idea of having this safety net for later in life isn't practically there for most diseases, whereas if we have donations from a large percentage of the population and we have a robust public bank, then the whole society will be able to have their own safety net. So it really is kind of changing that mindset as to what is going to be the most beneficial, even for themselves and all of society, is to have that public bank. And really, American College of Obstetricians and Gynecologists and Royal College both recommend for routine cases, both recommend the public bank over private storage. And so getting that mindset out that the international organizations really recommend the public bank is something to overcome.
Thank you. Dr. Samina.
Can I come in over here? I totally agree with her. I think we should make it just a public, but parents needs to donate. It's almost like paying an future income tax for your child. So, give it if you can, or donate if you can. If this is the baby which needs delayed stem cord clamping, then in that case, just donate. So you have access to the National Bank. But I don't think any of this should be for free. It is just like NHS. Most of the drugs are being thrown out because they are given for free. So I do feel that stem cells shouldn't be for free. Let people understand its importance and donate in whichever shape and form.
Thank you. And we're almost out of time, but just to end on something of a high, a question for all the panelists. So it's my understanding that stem cells are currently approved to treat in excess of 80 diseases, and research is continuing. So the future for stem cell therapy is bright and expanding. And the stem cell bank can serve research as well as therapy. There's a research arm to it as well, Dr. Hatim.
Actually, this is the beauty about Abu Dhabi Biobank. Since we have collecting cord blood banking, we have certain criteria to be accepted as a transplant. As a transplant, we can say this is a cellular dose. Cellular dose, that means you need certain number of stem cells with certain viability, so as to be accepted as therapeutic dose. That means we need this number to be as therapeutic dose. The one which is less than that in other cord blood banking, most the time they are taking it to the medical waste or the clinical waste. But we are consenting our patients that whatever your sample is not meeting the criteria of acceptance as a transplant, we are taking it for another branch, which is the research. Why we are doing research? We are doing research. First of all, we need to study the criteria of acceptance and rejection regional-wise, because what we are depending on it now, the American, the European criteria, which is completely, again, different than the ethnic group which we have here. This is number one. Number two, we can study the different spectrum of any drug. We need to do it in our people. So again, we are going back to the precision medicine, and this is why we are doing our research. Of course, we are telling everyone we are not doing cloning research, as the misconception coming, and this is one of the questions by the patient, what you are doing with our stem cell. We are doing it according to the legal form of the UAE regulation and research.
Thank you, Dr. Hatim. So we're officially out of time. If there are any questions on the floor, I'm conscious that we've got the last session. No?
So just to clarify, there are 3 ways of stem cells. One, we are using it for therapeutic. The second is research, trials. And the third is experimental. There is an experimental wing as well. So 3 ways the stem cells are used at the moment in a big institutes around the world. And that's what Dr. Hatim over here is doing.
Thank you, Dr. Samina, and thank you to all my panelists.
Fantastic. Thank you so much. And may I ask the photographer to please take a photo of our panelists before we release them, and say thank you so much for our audience for joining us for day 1 here at M42's main stage at the inaugural Abu Dhabi Global Healthcare Week. I'm sure you'll all agree that we've had a fantastic program for day 1. We have day 2 and day 3. A big round of applause again for our panelists. Thank you so much, and thank you to you all. We are back here for day 2 from 10:30. Please join us then. Thank you. In that case, I might join as well once you've done the panelists.